Hannah.
Hi, I'm Humera.
And we're nurses here on the neonatal unit at Bradford Royal Infirmary.
This video is designed to be a virtual tour of the neonatal unit, just so that it feels more familiar when you're here with your baby.
After watching this video, you might have some questions.
But don't worry, a member of staff will be happy to help.
The neonatal unit is located next door to Delivery Suite and the Birth Centre on the ground floor of the Women's and Newborn unit at BRI. It is accessed via Smith Lane and it is separate from the main hospital building, but it is still on the same site. There is a hospital car park right opposite the Women's and Newborns unit at Gate 5. Please speak to your nurse or midwife about parking permits, as parking is free for our parents.
This is the main entrance to the neonatal unit, and parents have 24-hour access. Please feel free to spend as much time as possible with your baby. Please ask your nurse for an up-to-date copy of our visiting policy for other family members. When you want to come in, you press this buzzer here and a member of staff will open the door. Please don't allow other people to follow you onto the unit.
Hygiene is important on the neonatal unit to help prevent your baby developing an infection. So when anyone comes in, staff or family member, they must take off their coats and wash their hands here. Outdoor coats need to go in one of the lockers provided. You will need a pound coin or a trolley token for the lockers. In the nurseries, we have more sinks for hand washing and each baby will have their own hand gel. Your nurse will explain when to use this.
Around here is the family room, parents' bedrooms and the parents' kitchen. We provide meals for all parents who spend long periods of time on the neonatal unit with their baby. Please ask your nurse how you can access this food. There is also a small cafe in the maternity block and there are lots of other food options over on the main BRI side. There are some sandwiches and cereals in the parents' kitchen which you can help yourself to.
Next we have all the nurseries. The babies requiring more intensive care will be at this end of the neonatal unit. Usually the babies who are closer to going home are at the far end of the unit. The rooms have a numerical name as well as a floral name which matches the colour of the walls in that nursery. They are as follows: 0.5 Blossom, 1 Violet, 2 Bluebell, 3 Cornflower, 4 Ivy. Then we also have Poppy Room, which we sometimes call the Orange Room.
All staff members will introduce themselves to you when you meet them. There will be a nurse assigned to your baby and then a senior nurse in charge of the nursery. Nurses provide most of the day-to-day care for your baby. In intensive care, a nurse is usually looking after 1 or 2 babies. In lower dependency, the nurse will be looking after 3 to 4 babies. Your nurse can answer your questions, support you to feed and take care of your baby, and they can also arrange for you to speak to the doctors if needed.
The daily ward round starts at 9 a.m. This involves a consultant of the week, doctors and nurse practitioners, as well as the nurse looking after your baby. The ward round is where the medical plans for your baby's care are made. Your voice matters and it is important for you to be part of a discussion about your baby, so we would always encourage you to join ward round when possible. You may meet other staff members such as infant feeding support workers, nursery nurses, pharmacists, dietitians, occupational therapists and physiotherapists.
There are just a couple more rooms I wanted to point out. Here is our expressing room. Expressing breast milk is one of the best things you can do for your baby. Some women like to use this room to express, while other mums prefer to express by the side of their baby's cot. We can also put up screens if you prefer. Expressing milk is a new skill that you will learn and takes a bit of time, but we have lots of support available for you, including breastfeeding specialists, our nurses and support workers who will also be able to help. We will talk you through how to safely store your milk if you're expressing at home or on the unit.
And then this is the back entrance to the neonatal unit, which may be the way you were brought for the first time to see your baby. Sometimes this can be confusing, but please do just ask if you get disorientated. Please remember, we're happy to answer any questions you may have either in person or on the phone about your neonatal journey.